Issues with the thyroid can affect your health in many ways. Did you know that can include your eyes and vision? In this episode of OCuTALK, ophthalmologist James Chelnis educates us on thyroid eye disease, the symptoms to look for, the treatment options available, and how those options have evolved in recent years. Dr. Chelnis?
I want to talk to you.
Not now, later.
No, now.
Hello, everyone, and welcome to OCuTALK. Today, we're going to be talking with Dr. James Chelnis, who is an ophthalmologist with Manhattan Face and Eye in New York, New York. How are you, Dr. Chelnis?
Doing great, thanks. How are you?
I'm doing fantastic, You know, at the beginning of these calls, we always like to start off by just giving a little bit of history. There's kind of a wide breadth that ophthalmologists and optometrists can work in. So can you give us a little bit about your background and your specialty?
Sure. So I'm an oculoplastic trained ophthalmologist, and essentially I did my fellowship in Tennessee, and after completing that, I moved back to New York, where I'm from actually, and worked in Mount Sinai and New York Eye and Ear for a while, and then followed that by starting my own practice, which is Manhattan Face and Eye. So that's where I'm currently working, and we're in the heart of Manhattan. And our expertise is in oculoplastics. So that's all of the supportive tissue and conditions that occur in the area around the eye. And that includes the obvious orbit and external structures that we can see.
I think what we found is that thyroid eye disease, or just thyroid in general, you hear a lot about, like, people saying they have gluten allergies, people having thyroid disease, other things. Is that related? Are the two related? And what is thyroid eye disease? What is the thyroid?
Thyroid eye disease. So I guess the initial, I think, impression on people is that there's this funny connection of thyroid and eyes. And unless you have, or someone in your family has, a thyroid condition, you probably don't think about your thyroid ever throughout your life. But in a way, it's sort of like a thermostat for your body, because the hormones that it produces affect essentially weight gain or loss, how fast or how slow your heart beats, how anxious or relaxed you may feel, actually. So it's not the only thing that controls all of these elements, obviously, but it is sort of a thermostat for your metabolism and how quickened or quiet, I guess, your body is functioning. And in terms of what you're talking about, like gluten and so on, I mean, I think especially in the United States, unfortunately, there's been an explosion of immune conditions, autoimmune particularly conditions, which just means that your body is fighting itself. And so if you have an allergic condition, like with the gluten in sensitivities that we're seeing, or in the case of thyroid disease, where it's autoimmune, where your own body is fighting against itself, then we've certainly become more sensitized, it seems, to these molecules and antigens, as they're called. Antigens just being the molecules that our body interfaces with. We've become more sensitive to them and more reactive to them. We see that a lot in asthmatics. Diabetes is an autoimmune disease. There is now some question of whether Alzheimer's is similar just to the brain. So there definitely has been an explosion of research, but also recognition of autoimmune conditions.
So, when we're talking about thyroid conditions, we're talking about autoimmune conditions. But specifically, is thyroid eye disease separate and apart from what you might have with a regular thyroid problem? In other words, is thyroid eye disease something that you can have independently of other thyroid issues within the rest of your body?
Thyroid eye disease is basically the result of a peculiarity about your body. So essentially, you can have a lot of different things happen to your thyroid, but in particular, there's something called Graves' disease, which typically is associated with a hyper or overly active thyroid gland. And in that case, we have found certain receptors to be targeted unnecessarily by your body, mistakenly. And so some of those receptors actually happen to also exist in high concentrations of the tissue behind your eye. And so for that reason, you have your immune system, which is already improperly gating. It's attacking your thyroid. Well, this improper gating also can lead to a mismatch and or a finding of those same receptors behind your eye. So most people, they actually have the thyroid symptoms, the manifestations of the disease attacking their thyroid before they have changes to their eye. But there actually is a subset of people who their thyroid is still completely normal and they have manifestations in their eye only. And so those patients, because as I sort of joke, they didn't read the textbook, they didn't operate according to what our normal dogma is. Unfortunately, they're usually found out and diagnosed later on because it's sort of a curveball and it's harder to recognize.
So, and I had heard about this association with Graves' disease and thyroid eye disease before, and my understanding was you were talking a little bit about how we're attacking some of the different parts around the eye, and my understanding is that what we're talking about here is sometimes certain sunken-in look that can come. I mean, what are some of the symptoms related to thyroid eye disease?
With thyroid eye disease, there are, if I leave it in a nutshell, there are two parts that we really mind a lot in thyroid eye disease, which is the front and behind your eye. And what that means is that the surface of your eye can become very dry, irritated, exposed. And behind your eye, you have a swelling of tissue, which in the more severe cases, the more serious cases, can actually lead to compression of your optic nerve, which is how what you see, that information gets to your brain in the first place. So without it, you can't see. And so if it becomes injured, you can have irreversible harm to your vision. And this all happens because of inflammation mediated pathways that lead to your muscles being restricted around your eye. So that means that maybe your eyes don't move as well as they did before. You can have double vision as a result of that. That swelling of the fat and the muscles behind your eye can cause a forward pushing of your eye, so you get this sort of larger appearance of your eyeballs, like they're almost popping out of your head. And unfortunately, in most severe cases, that can actually happen. That the eye can sublux and sort of end up in far too forward. Luckily, it's only in the most severe cases, but it's something that we obviously look for, and it's something that we make sure is not occurring, meaning the compression of your nerve or like the profound swelling behind your eye.
So I guess the primary symptom here is that swelling, would you say? Is that the primary symptom of the thyroid eye disease?
So because it's an autoimmune mediated disease, basically the immune system, which generally is supposed to find and kill intruders in your body or misbehaving cells of your own body, it's killing and destroying and swelling in areas where it shouldn't be. For the thyroid, that means it's breaking thyroid cells and releasing extra hormone, and that's why your level goes up. And for behind the eye, it could mean that it leaves no space for the critical tissues that you need and actually starts to impair their function. So, it's sort of seems like a funny thing, but if your eyes are dry, that can affect your vision because there's not enough, let's say, oil and water on the surface of your eye. That's the first thing light hits. So something that seems so simple, that little ecosystem on the surface of your eye is actually quite complicated. And if it's impaired, then it can just alter your vision, and it alters it in a variable way, which is really frustrating for patients because they have vision that's actually changing day to day.
So, we've talked a little bit about thyroid general disease. We've talked about how it can affect the eye. But let's say I'm a patient and I have some thyroid problems to begin with. Is it a given that I'm going to have thyroid eye disease? And specifically, let's use the example that I have Graves' disease. Is it a given that I'm going to have these eye problems? Or is this just something that I should really look out for? And if I'm looking out for it, right, if I'm a thyroid patient and I'm looking out for some signs and symptoms that could be indicators of a larger problem, what is it I'm looking out for?
It's not necessarily a given, But there's something that's very interesting that's happened with thyroid eye disease treatments that has shifted our interest in terms of when the patients should see the doctor. So in terms of what you can see, I mean, a lot of people have dry eyes.
Right.
That number, it's not helped by the fact that we're always on screens. We have, ironically, this reading on the screen. People are watching this on the screen. It's to our benefit. We're learning, but at the same time, the risk is dryness of your eyes. So I wouldn't say that everyone who has dry eyes should get a thyroid eye disease screening necessarily. But if you have out of proportion symptoms, people generally understand like, oh, my eyes are a little gritty day to day. It's fine. It's not a big deal. But hey, it's getting worse. My eyes are more red. My eyes appear larger. Perhaps my lid is more open. I look sort of more intense than I did before. I have lost the softness of the area around my face. Then that actually could be thyroid eye disease, because the muscles of your lids become restricted and don't allow your eye to open and close, and sort of the eyelids can't serve the surface of the eye like they used to. It is particular to Graves'. There are other autoimmune conditions of the thyroid that don't cause thyroid eye disease. Like the most common one is Hashimoto's, that lowers your thyroid function. But that one isn't really associated with these changes. Very rarely, I would say. So the thing that's changed about treating thyroid eye disease patients is that it used to be, well, let's just keep you comfortable, wait until the immune system sort of calms down after a while, which typically happened after a few years. And now we can treat you and maybe reposition everything back to where we want it to be, put your eye back in place, free up your muscles if we have to, if they're too tight, stuff like that. Largely, that's surgical. In the last half a dozen years or so, there's been a big shift, because for the first time, we have medication that we can give patients that can actually undo some of the inflammatory changes that exist behind the eye, and actually return them back to their normal appearance, without waiting for the disease to die down, and like waiting that few years gap that we used to have to wait, to be confident that it's time to go in. And so thyroid eye disease, by its nature, it's a team sport. So the hormonal problems are generally dealt with by specialists in that field, which is endocrinologists. And then the eye problems are typically dealt with, particularly the more severe things, the orbit problems, more by oculoplastics, but other eye professionals. And so the importance of that is that I think whereas before we had time, now it's to the patient's benefit to not waste time and to get treatment to reverse the changes as quickly as possible. It's hard to get the team in some cases all aligned in that pursuit, because it's such a sea change in what we wanted to do and how we treated these patients before. So I think it's probably more important than ever before to talk about thyroid eye disease, to make sure that patients are aware of it, or other physicians and professionals are aware of it, to make sure these patients are treated appropriately.
So let's talk about that for a second, because it seems to me like in a lot of cases, it sounds like you, as the ocular plastics person, you're not typically diagnosing somebody, like somebody's coming from an endocrinologist or some other doctor because they already had an underlying thyroid disease. But at least generally, that's the way it goes. And what you're saying is part of the problem is that these other doctors that are in this mix, or just everybody in general, because the sort of understood MO prior was wait till the inflammation goes down, wait till the issue passes, and then we'll treat it, right? But based on some of what you said earlier, that if this advances too far, that we can have some real permanent problems, right? Which are things that you used to just have to deal with, right? Because again, the MO was wait. But now that we have these new treatment modalities, right, that it might be beneficial for all parties involved for us to get in early and start looking at these treatment options, because it might be that we can affect change now before the possibility of greater harm being done. Would you agree with that statement?
Yes, I think the thing that's interesting about thyroid eye disease is most patients are really eager for treatment. They couldn't really engage in their eye treatments early before, but they're really eager because it changes their identity in a way. Because now sort of their appearance and a lot of nonverbal communication is altered. I actually literally had a patient with thyroid eye disease. He had a pretty severe case. He was almost arrested on his own front lawn because he called the police, and because his eyelids were so restricted and open, they thought that he was on drugs.
Oh, wow.
And he was like, "No, no, I'm just trying to alert you to something else going on." And they put him in handcuffs, actually, and so, you know, I'm not saying that that happens to every patient with thyroid eye disease, but you can see one critical conversation where that patient's ability to communicate effectively was compromised. And on a day-to-day scale, when you're working and you're with your family, never mind the fact that an overactive thyroid can leave you feeling anxious. Uh, your appearance is altered, and it can affect your ability to connect with others around you. So I think that a lot of thyroid eye disease patients, they're a little more detached from their lives, and that leaves them more vulnerable than they have to be. And so that's another reason why I think, I don't think there's a way to really overstate like the psychological effect of a patient suffering through thyroid eye disease as well.
Yeah, absolutely. And I think unfortunately that's the way of the world, right? That appearance really does go a long way. And I can certainly see your point there. Let's talk a little bit. We talked about that there's some new treatment modalities, right? Like the options that we didn't have before. Let's walk through both the new ones and the traditional way of treating thyroid eye disease, so that anybody that's dealing with, what could I look forward to treating this?
So the most common symptoms that thyroid eye disease patients get are their ocular surface symptoms, so that are similar to dry eyes. And so historically, a lot of those treatments are really similar to dry eye disease treatments for other patients. Coincidentally, we just had a paper accepted and is being published that indicates how the little research that exists on finding out whether those same treatments that are used for general dry eye patients work for thyroid eye disease patients. And indicators point to no, they don't actually, because of this inflammatory mediated response, that generally they're undertreated in that regard. So, that's sort of the most common way that most common need they have. And I think they're definitely undertreated in that regard. Beyond that, there are generally three types of surgical interventions that classically would be used once the disease was stable, which is orbital surgery. So that's surgery from behind the eye to decompress the space, give them space for enlarged and swollen tissue so their eye can be put back into its normal position. There would be eye muscle surgery. So if you have double vision from the eyes not working as a team anymore because some of the muscles are restricted and some of them are not moving fluidly, then you can have strabismus surgery. And then the third type would be eyelid surgery. So beyond that, that's more dealing with the external muscles and appearance of the eyelids on the outside. And that would be sort of a third step that would be used to basically regain your identity, to put your eyelids back to where they were before so they can function normally, serve the surface of the eye. And then there were other things that we used to acutely try to gain control of situation if it was out of hand, because as I've mentioned before, we generally just waited until the disease was burned out. But sometimes people are in such a bad state that you have to do something to temporize it. And so in that case, historically, we'd be either giving people large doses of steroids, or sometimes radiation, low levels of radiation, but yes, radiation to their orbit to kill all the inflammatory cells. So it's sort of interesting thought. The radiation affects the cells that are sort of replicating the fastest and the most. And so if those are the inflammatory cells in an area, then you can selectively kill those so they can't harm you anymore. You can repopulate those cells if you have a continued disease process, but at least it can buy you time. And so, it was pretty involved and difficult to get people to stop their disease in its tracks, essentially. Um, and so now we still have all those things if we need them, of course, and some people do for sure. And but for others, if we catch them especially in an active disease state, and sometimes even with chronic disease, we can treat them just actually with infusion medication. And so the infusions, they are planned out over several months. They're immunomodulatory, not immunosuppressive, with the difference being that it stops your immune system from targeting the targets it shouldn't be targeting in the first place. It doesn't suppress your body's ability to fight infection or things that you're facing from the outside. And so that leaves them at least in a normal immune state without the extra attack on the receptors they shouldn't be firing on or attacking. And then we've seen, obviously it's not the same result for everyone, but in some cases we've seen really remarkable results for these patients where you would previously have needed to perform surgery to create the effect, the amount of change that they've gone through with infusion medication.
Is it possible for this to affect one eye and not the other, or is it always both eyes?
That's a great question. Sometimes it can appear that way, actually, because the disease is very asymmetric. So one of the characteristics is that it's asymmetric. So some people have bulging, what's called proptosis of their eye forward on one side and not the other side. Some people have, look almost completely normal on one side and foreign on the other side. So that's sort of an extra component of this, because in many ways that makes it harder to treat, especially if you're using those surgical tools and so on, because I have to do asymmetric surgery to get the patient back to normal.
Yeah. So I'm curious on my part is, we talked about that this inflammation can cause problems, right? And let's say we got one of these infusions and some of that inflammation went down, right? Is there still a need for intervention on your part to, like, I guess what I'm saying is it going to bulge out and then after the inflammation goes away, it kind of goes back to normal? Or are there parts of the eye that are damaged because of the inflammation that I had?
So they can be. If you have unchecked inflammation, you can lose fibers of your optic nerve. So if there's enough swelling around it, then if that nerve is damaged, even if you undo the swelling later on, you could lose vision permanently. And otherwise, the front of the eye doesn't suffer necessarily the same way, because if you undo the inflammation, typically people do improve. But you can have long-standing effects that are on the surface of your eye if it gets too dry, or in rare cases, I've seen serious problems with the surface of the eye.
Let's touch on that. I think you touched on this a little bit a second ago when we were talking about how a lot of times this is just treated as though it was just plain dry eye. But it would seem to me that really when you're doing that, like, yes, you feel better, perhaps, right? Like, yes, your eyes feel better when they're moist and not dry. I think we all understand that. But I think what you're saying is that although it feels better, right, that nothing has actually changed, right, based on the research that we're seeing now, right? The thing that caused the dryness is still there. It might feel better temporarily, but based on, I believe what you said a second ago, that's not necessarily treatment, it's dealing with the symptoms. Is that true, or is that the proper way of saying that?
So two things. That is true, that the more upstream in a process you can be, the more you can actually treat the underlying cause. But secondly, actually, thyroid eye disease patients typically get less relief from the same measures given to other patients with dry eye disease. So they're not even getting the same symptom control. Never mind the fact that, controlling the symptom can give you temporary relief, but it's not going to solve the problem. It's going to be right back once that wears off. So yeah, it's sort of like a double whammy for the thyroid eye disease patients.
Yeah, absolutely. Well, and I think we've talked about a lot here that, again, so you can have thyroid eye disease, right? In most cases, it's associated with Graves, but you can have thyroid eye disease and have a seemingly normal thyroid, which is true, correct?
Yep.
You also typically, somebody like yourself is getting referrals from somebody else, that somebody's dealing with a thyroid issue, and that's when they're coming over. And historically, it may have been understood in the medical community that we need to wait for that inflammation to get done before anybody like Dr. Chelnis can get in and do something. But that's not true today. That's not true today. And I think one of the things that you really want, seemingly want to get out here today is that part of the treatment of waiting for the inflammation to go down before we can do anything is just simply not true anymore.
Yes, and I think the other side of that is that it's probably harder to get in to see a specialist as a new patient than ever before as well. So, combined with that, I think I know I have other conditions that I treat that are also, as I say, team sports. And I've been always under the impression that I should get this patient to be seen by the other specialist as quickly as I can, even if there's not something critical going on yet, because then they're an established patient. Then they're going to have a much easier time getting in and getting taken care of. They have a connection already. And I think the same of thyroid eye disease, where most of the time patients are flowing more from the endocrinology side to the eye side, but sometimes that's not true. And I, whenever I see a patient and diagnose them first, or they haven't seen an endocrinologist yet, I always make sure that they urgently get in to see somebody, even in the patients who don't have the thyroid changes yet, because a lot of those over a few years can convert to having Graves' disease of their thyroid as well, the thyroid portion of it. So I just think that it's great to have all hands on deck and have the patient treated as quickly and as soon as possible, and as completely as possible. So yeah, I think that the important thing is to know that employ the tools you have as a provider, which includes other specialists, but also not to have the patient wait, because even if at worst they have a normal exam when they're seen by the specialist, they're on their radar. And if something happens, you have access to them moving forward.
And I think that's an excellent point. And I've got a couple follow-up questions to it. Number one, I'd like to say, we've talked about this on the channel a lot. Dry eye is not something that you should have to deal with generally, unless you're dealing with some environment issues. Like if you find yourself constantly having dry eye, talk to somebody about it. There are ways to solve it. The other thing is, you should also not be feeling pressure generally inside of your eyes. And if you are, you need to go and talk to a doctor about that. But the final thing I wanted to ask is, let's say that I'm having these symptoms, right? Let's say whether I'm a thyroid patient or not, right? And I'm having some of the symptoms we described here. Where should I start? Should I start with the ophthalmologist? Should I start with the endocrinologist? How can I help as a patient solve this problem that we're describing here of getting in sooner to see the specialist?
So I think that the patients that are going to tend towards the endocrinology side are the patients who they really don't feel like themselves. Their weight has changed. Their hair might be falling out or oily or greasy. Their skin quality can change. Their heart may have even an arrhythmia in extreme cases where their heart's just beating faster than it should be. So your bowel movements can change. Like I was mentioning at the beginning, the thyroid is sort of like a thermostat for your body. So when it's going wrong, a lot of things go wrong as well. And so the patients who have those symptoms, systemic symptoms, they should seek a thyroid specialist, probably, at least their primary care doctor, if they already have a connection to one that will help them get oriented towards someone who can help. And then as far as the eye side of things, the thyroid eye portion, yeah, I mean, I think if you're not getting relief from typical dry eye treatments, that may be related. If you feel that your appearance has changed around your eyes, those are one of the things that are most notable to patients is they find, hey, it's more puffy around my eyes because it does swell around your eyes as well. My eye looks more like bigger, or I look always very alert or intense, and luckily those things happen usually before your optic nerve is compromised, and because that's actually quite difficult to pick up on in the early stages for a patient to like see that in themselves. So if you notice that, then I think it's time to seek out a specialist. And uh, as I mentioned, obviously, oculoplastics is a good fit, but if you're already connected to someone, if you have an optometrist you see, an ophthalmologist you see, then inform them, and hopefully they can connect you with someone who can take your care to the next level if you need to.
Is there anything we haven't talked about that's important for the audience to know about thyroid eye disease?
I mean, I think just to know that things are really changing rapidly, and for patients suffering with this disease state, there is an ever increasing amount of research being done to serve thyroid eye disease patients. Uh, you know, I think, like I was mentioning before, it really can or has the power to compromise or affect a patient's identity. And so, thank goodness we're finally in a phase of technology where we don't have to let patients suffer for years on end before we can start to think about getting them back to them being themselves. And I'm very excited about the future for our thyroid eye disease patients because I know that more and more tools are going to be available or made available to them.
Absolutely. Well, Dr. Chelnis, thank you so much for being with us today. And as we say on the channel all the time, do not ignore eye issues. You only get two of them.
Really appreciate you guys inviting me here, and it's been great to talk about this with you.